Endothelin peptides are derived from a 203 amino acid peptide precursor known as pre-proendothelin. After translation, the precursor is cleaved to form proendothelin, and a converting enzyme within the endothelial cells further cleaves proendothelin to produce endothelin. While all three members of the endothelin family of peptides, that is, endothelin 1, endothelin 2, and endothelin 3, are expressed in the cardiovascular system, endothelin 1 is the predominant isoform. Endothelin 1 is the most powerful vasoconstrictor in humans, and its levels are elevated in hypertension. Although tissue concentrations of endothelin 1 are not typically raised in patients with essential hypertension or most form of experimental hypertension, unless renal failure, endothelial damage, or atherosclerosis are present. It acts in a paracrine fashion, regulating nearby vascular smooth muscle cells. Endothelin 1 can induce a hypertensive effect by activating endothelin type A receptors in the kidneys, or an antihypertensive effect via endothelin type B receptor activation. The influence of endothelin 1 on blood pressure regulation depends on where it is produced and which endothelin receptors are activated. Endothelin 1 receptor binding sites have been identified throughout the body, with the kidneys and lungs having the greatest number of receptors. Endothelin 1 produces vasoconstriction, impairs renal pressure natriuresis, and increased blood pressure via endothelin A receptor activation. Endothelin A receptors, primarily located on vascular smooth muscle cells, mediate endothelin 1 vasoconstriction and cellular proliferation in various disease states. Endothelin 1 through endothelin A receptor activation exert multiple action within the kidney that, if sustained chronically, could contribute to the development of hypertension and progressive renal injury. Activation of renal endothelin A receptors increases renal vascular resistance, which decrease renal plasma flow and glomerular filtration rate through stimulation of vascular smooth muscle and mesangial cell contraction. Long-term effect of endothelin 1 on kidney include stimulation of mesangial cell proliferation and extracellular matrix deposition, as well as vascular smooth muscle hypertrophy in renal resistance vessel. Decreased renal plasma flow and GFR enhance sodium reabsorption by decreasing peritubular capillary hydrostatic pressure. The net effect of renal endothelin A receptor activation is decreased sodium excretion and increased blood pressure. Conversely, endothelin 1 can elicit an antihypertensive natriuretic effect via endothelin B receptor activation. Endothelin B receptors are located on multiple cell types throughout the body, including endothelial cells and renal epithelial cells. Endothelin B activation causes vasodilation, enhanced pressure natriuresis, and decreased blood pressure. Activation of renal endothelin B receptor leads to enhanced synthesis of nitric oxide and prostaglandin E2 and suppression of renin-angiotensin system. The net effect of renal endothelin B receptor activation is increased sodium excretion and decreased blood pressure.